name's Dr Gemma Eyres. I'm a ST1 GP trainee at the Royal London Hospital. The reason we're striking is that we want safe and fair working conditions within the NHS. At the moment, the government is proposing a contract which is both unsafe for us to be working and unfair. They're removing some of the safeguards that will stop us from working excessive hours, and that is likely to cause more and more mistakes. We want to do our best, and we love working for the NHS, but if this new contract comes through, I'm worried that I'm going to be overworked, I'm going to make mistakes, which is going to affect patient care. And also it's unfair. We work very, very hard for the job we do. We get paid well for it at the moment, but what they're trying to do is give us a pay cut, which is unjustified when we are working at the brink of what we can do at the moment.
You want to be a GP, so what are your kind of fears for how this kind of contract could affect general practice?
So one of the recommendations was to remove the financial banding we get whilst we're on GP practice as a trainee. That would be almost a 30% pay cut. And at the moment we've got a massive, huge shortage in terms of GP trainees in the country. We need more GPs, and to offer a 30% pay cut to GP trainees, there will be no incentive for anyone to go into GP. And particularly for myself, I've come from emergency medicine. I was an emergency medical trainee, and now I've moved into GP, and I bring with it experience, and I want to do well in GP, but I will get massively penalised for changing to a GP specialty, even though it's short in terms of recruiting people.
You're actually working today. You're working in the A&E. What kind of response are you seeing from patients to the strike going on?
So today we're running what we call a Christmas Day service. So all emergency services are running. So please don't not come to hospital if you feel unwell. And patients overall are very supportive. I was really pleased to hear that a BBC survey that was sent out yesterday showed that sort of around 60% of the general public supported this strike. I'm sorry it's come to this. I'm sorry to patients that we've had to come to this point, but I genuinely think that if we don't stand up for us, then nurses will be next, doctors will be next, and the NHS will crumble.
Any thoughts about how GPs, working as GPs at the moment, can support this?
So I'm really, really lucky. I work in the Tower Hamlets GP training scheme, and we've had so much support from GPs. They've been wearing our badges, they've been putting signs up in GP practices. There's a great little video that the Tower Hamlets GPs have created and put on Facebook and YouTube, just supporting us. So I think just to all GPs out there, thank you for your support already. And if you're not sure, please continue to support us by sort of letting patients know what we're doing. This is for the junior doctors who are going to be the future GPs in this country. So thank you for supporting us, and keep going.